Good morning. In this session, we'll be dealing with the anatomy of axilla 1. So there will be a separate lecture on brachial plexus. So we are not going to discuss brachial plexus in this particular section. We'll be seeing the boundaries, contents, and axillary artery as the main features of this session. So axilla is also called as armpit. It is pyramidal in shape. It is located between the upper part of the arm and the lateral thoracic wall. The following features are the highlights, like the axilla has an apex, base, and it has 4 walls, namely the lateral wall, medial wall, anterior wall, and posterior wall. You can see here, this is the apex, otherwise called as cervico-axillary canal. You can see this is the base. So between the anterior axillary fold and posterior axillary fold, you can see this is the medial wall, which is formed by the chest wall. You can see the lateral wall, which is the narrowest, and you can see this will be the anterior wall, this will be the posterior wall. So apex, also called cervico-axillary canal, it is truncated, and it is directed upwards and medially towards the neck. So if you see the overall boundaries, it will be triangular. In front, it will be bounded by clavicle, behind by the superior border of scapula, and medially by the outer border of the first rib. Structures passing from neck to the axilla are axillary vessels, brachial plexus. So this will be covered by the axillary sheath. Then long thoracic nerve, efferent supplemental lymph trunk from the axillary lymph nodes. Base, it is concave. So from below upwards, if you see, or from superficial to deep, if you see, there will be skin, superficial fascia, and axillary fascia, which is a deep fascia here. Axillary sheath is different and axillary fascia is different. Axillary sheath is derived from the prevertebral layer of the deep cervical fascia, whereas axillary fascia is the deep fascia in this region. So axillary fascia, which is supported by suspensory ligament of axilla, which is an extension from clavipectoral fascia. So front, there will be anterior axillary fold, which is formed by pectoralis major, and behind there will be posterior axillary fold, which is formed by the latissimus dorsi on the medial aspect and teres major on the lateral aspect. So medially, it will be the chest wall. These are the boundaries of the base. Anterior wall is formed by pectoralis major, pectoralis minor, subclavius and clavipectoral fascia, and suspensory ligament of axilla. So all these will be structures below the pectoralis major. So from above onwards, if you have remember the diagram of clavipectoral fascia, above the clavipectoral fascia includes the subclavius, then clavipectoral fascia, then pectoralis minor. So from the lower part of pectoralis minor, it becomes suspensory ligament of axilla. Medial wall, upper 4 or 5 ribs and intercostal muscles, and serratus anterior muscle upper part, long thoracic nerve which supplies the serratus anterior, which will pass behind the mid-axillary line. An intercostal brachial nerve will pierce the medial wall and supplies posteromedial part of the arm. So now if you observe here, this is the anterior wall. You can see the pectoralis major and you can see the pectoralis minor. So especially this is taken at the section of second part of the axillary artery. We'll discuss further parts of axillary artery later. And here you can see this is the lateral wall. So bicipital groove with long head of biceps, short head of biceps, and coracobrachialis. And here you can see this will be the posterior wall, which is formed by the subscapularis, teres major, and latissimus dorsi. And here you can see the medial wall with serratus anterior and chest wall. So this will be the cross section of axilla. And here you can see the second part of axillary artery. Remember the relationship of the chords of the brachial plexus. Their true name is justified in the second part. That means if I say posterior chord of brachial plexus, it is posterior to second part of axillary artery. If I say lateral chord of brachial plexus, it is lateral to second part of axillary artery. If I say medial chord of brachial plexus, it is medial to the second part of axillary artery. Okay. Medial chord medial, posterior chord posterior, lateral chord lateral. So this relation holds good with only second part of the axillary artery. Lateral wall, it is narrow. Both anterior and posterior wall converge. So where it is located, it is the intertubercular sulcus of humerus. So there lies the tendon of long head of biceps brachii, coracobrachialis, and short head of biceps. All these are in relation to the lateral wall of the axilla. As I have shown in the diagram, see here, bicipital groove or intertubercular sulcus, long head of biceps, short head of biceps, coracobrachialis. Posterior wall, subscapularis, latissimus dorsi, and teres major. I have shown in the diagram. Subscapularis, latissimus dorsi, and teres major. Here also you can see the subscapularis, latissimus dorsi, and teres major muscle, all three forming the posterior wall of the axilla. You can also see the These are the few branches of the posterior cord of brachial plexus, the upper subscapular nerve, thoracodorsal nerve supplying the latissimus dorsi, lower subscapular nerve, these two supplying the subscapularis muscle. Here you can see the axillary nerve and the continuation of the posterior cord, the radial nerve. The contents of the axilla: axillary artery and its branches, axillary vein and its tributaries, cords of brachial plexus and their branches. So this will be discussed in the next class. Long thoracic nerve, intercostobrachial nerve, axillary lymph nodes, axillary fat, and axillary tail of mammary gland or axillary tail of pens, which extends into the axilla. So you can see the contents, the axillary artery, the red color one, and you can see the axillary vein. So throughout the course of the axillary artery, axillary vein is accompanying on the medial aspect, slightly posteriorly. Okay. So axillary vein is a medial relationship of axillary artery. And here you can see this will be the medial cord, this will be the posterior cord, this will be the lateral cord. Here you can see a loop of communication between the lateral pectoral nerve and medial pectoral nerve. And here you can see this lateral cord continuing laterally in relation to the second part, posterior cord continuing posteriorly in relation to the second part, the medial cord continuing medially in relation to the second part. And if you come to the third part, that means this particular pectoralis minor is dividing the axillary artery into three parts: the proximal, posterior, and distal. The part which is proximal to the pectoralis minor is the first part. The part which is behind the pectoralis minor is the second part. The part which is distal to the pectoralis minor is the third part. And here you can see these are the three cords of brachial plexus with their branches. You can observe here, this will be the medial cutaneous nerve of forearm. This will be the ulnar nerve. This will be the medial cutaneous nerve of arm. You can see the communication from intercostobrachial nerve. Here you can see the median nerve, which is having two roots. This will be the lateral root. This will be the medial root. Medial root is crossing in front of the third part of axillary artery. And here you can see this is the musculocutaneous nerve. So all these branches will be discussed in later, but remember this diagram, especially these relationships. So between axillary vein and axillary artery, you can see the ulnar nerve and medial cutaneous nerve of forearm. Lateral to the axillary artery, third part, you can observe here. This is the median nerve. Axillary artery. So for any artery, we are going to follow this schematic. Like we'll describe any artery with respect to origin, course and relations, branches, termination, and applied aspects. So now origin. So axillary artery begins at the outer part of the first strip as continuation of the subclavian artery, and the axillary artery terminates at the lower part of the teres major by continuing as brachial artery. So origin and termination. Next part, you can see the pectoralis minor divides the axillary artery into three parts. The part 1 is proximal to the pectoralis minor, and part 2 is behind the pectoralis minor, and part 3 is distal to the pectoralis minor. And here you can see the branches. The first part will give rise to one branch, superior thoracic artery, 1 and 1. The second part gives rise to two branches, the thoracoacromial artery and a lateral thoracic artery. Sometimes there might be an additional branch called alar thoracic artery. So 2 and 2. Then third part, so you can see the largest of all branches, the subscapular artery, giving rise to a small branch, circumflex scapular artery. And here you can see the posterior circumflex and anticircumflex humeral arteries. So three branches from the third part: subscapular artery, anticircumflex humeral artery, and posterior circumflex humeral artery. So origin, outer border of first strip, continuation of subclavian artery. Termination, lower border of teres major, continuing as brachial artery. Then three parts by pectoralis minor, proximal, behind, and distal. And the following branches: first part, one branch, superior thoracic; second part, two branches, thoracoacromial and lateral thoracic; third part, three branches. The largest one will be the largest of all branches, the subscapular, then the anterior and posterior circumflex humeral arteries. So sometimes additionally there might be a branch from second part, that is alar thoracic artery. So as it is around the shoulder region, so it also have crucial anastomosis, which I will explain later, collateral anastomosis. So origin from outer part of the first strip, it is the continuation of the subclavian artery. Termination at the lower part of teres major, continues as brachial artery. Pectoralis minor divides artery into three parts. The first part is proximal to the muscle, second part is behind the muscle, third part is distal to the muscle. You can see the relations of the first part. If you see the relations in front, skin, superficial fascia, platysma, and supraclavicular nerves. So once we dissect these things only, then we'll see the pectoralis major covered by pectoral fascia. And if we remove pectoralis major, we'll see the clavipectoral fascia. So in the first part, we cannot write pectoralis minor because pectoralis minor is lying in front of the second part. Then there will be a loop of communication between lateral and medial pectoral nerve. I'll show you in the diagram. And it is crossed by cephalic and thoracoacromial veins in the anterior wall of the axillary sheath. All these are in front of the first part. If you see behind, the first and second distillations of the serratus anterior muscle, long thoracic nerve, and medial cord of brachial plexus and medial pectoral nerve. See, in relation to first part, the medial cord is not medial, it is posterior. Okay. Then if you see in the lateral side, there is lateral cord of brachial plexus and posterior cord of brachial plexus. So posterior cord here, it is not posterior, it is also on the lateral side. Then medially axillary vein. So blindly you can follow for all parts the medial relation. One of the medial relation will be the axillary vein. So this you need to practice in dissection if you see, and if you practice the diagram, then you will get to know. You can see here. So this is the first part. You can see the posterior cord and lateral cord are lateral, and the medial cord is posterior. And in front you can see a communication between the medial pectoral nerve and lateral pectoral nerve. Second part, as usual, I said the second part is lying behind the pectoralis minor. So in front there will be pectoralis minor. So above and over it, pectoralis major with its covering fascia and skin. So behind posterior cord of brachial plexus, again laterally lateral cord of brachial plexus, medially medial cord of brachial plexus, along with that axillary vein. So behind there will be subscapular also, which forms the posterior wall of the axilla. So here you can see. So this is the second part of the axillary artery. The lateral cord is lateral, the posterior cord is posterior, and the medial cord is medial. And one more medial relation is axillary vein. And behind you can see the subscapularis. In front you can see the pectoralis minor and then major. So third part, pectoralis major. Again, pectoralis minor gone because pectoralis minor lies only in front of the second part. So now it is pectoralis major in the upper part, crossed by medial root of median nerve. I'll show you in the diagram. Then skin and fascia in the lower part. So behind, again, same thing. All the structures which on the posterior wall of the axilla, which I have shown in that diagram, like subscapularis, latissimus dorsi, teres major, axillary nerve, and radial nerve. So laterally, lateral root and trunk of the median nerve, musculocutaneous nerve, and coracobrachialis. I'll show you in the diagram. Medially, ulnar nerve, medial cutaneous nerve of forearm, axillary vein, and medial cutaneous nerve of arm. So let us see here. You can observe here. So in front, you can see the medial root of median nerve. Laterally, you can see the lateral root of median nerve and the median nerve. You can see the musculocutaneous nerve, and you can also see the coracobrachialis, which is pierced by the musculocutaneous nerve. So medially, you can see this is the axillary vein. Between axillary vein and axillary artery, you can see the medial cutaneous nerve of forearm and medial this ulnar nerve. And just medial to the axillary vein, there will be medial cutaneous nerve of arm, which will be having a communication from intercostobrachial nerve. These are the relations of the third part. So branches. The first part gives rise to superior thoracic artery. Second part gives rise to thoracoacromial artery, which further divides into 4 branches: 2 muscular like pectoral and deltoid, and 2 bony branches like acromial and clavicular. And second branch is lateral thoracic artery. Third part, the largest of all, will be the subscapular artery, then anterocircumflex femoral artery and posterior circumflex femoral artery. So rarely alar thoracic artery arises from the second part, and largest of all branches is the subscapular artery. You can see here the scapular anastomosis. It's also called as collateral anastomosis. It is present between the first part of the subclavian artery and third part of the axillary artery. So as you see there, anastomosis is between the first part of the subclavian artery and third part of the axillary artery. Why this anastomosis? So shoulder region is subjected to more movement. There might be any kind of stress and trauma which might block the distal parts of the subclavian artery and proximal parts of the axillary artery. So in order to have, like we are working in different positions, in order to have proper circulation, so there is an existence of anastomosis around the scapula. So there are 2 locations. One is seen in the following fossa like subscapular fossa, supraspinous fossa, and infraspinous fossa. The other is over the acromial process. So if you see in these fossae, the subclavian artery branches which are contributing here are the suprascapular artery and deep branch of the transverse cervical artery from thyrocervical trunk. And axillary artery branches are the circumflex scapular artery. And over the acromial process, the subclavian artery branches are acromial branch of the suprascapular artery, and axillary artery branches are thoracoacromial artery and posterior circumflex femoral artery. So you can see the branches contribution from axillary artery, and you can also see the branches contributing from subclavian artery. So all these form an anastomosis like this. You can see here, this is the anastomosis in the infraspinous fossa, anastomosis in the supraspinous fossa. You can also see there is certain anastomosis around the acromial process. So you can see this is a subpart. This is the first part of the subclavian artery, and this is the third part of the axillary artery. So any kind of obstruction here will be compensated by this collateral anastomosis. Axillary vein origin. So it starts at the lower border of the teres major as a continuation of the basilic vein, which is joined by a pair of vena competentes accompanying the brachial artery. So basilic vein and A pair of vena comitatus accompanying the brachial artery. So if you see the entire upper limb, there are two superficial long veins. So one along the medial side, the other on the lateral side. Lateral side, we call it as cephalic vein, and the medial side, we call it as basilic vein. So this medial side superficial vein, basilic vein, joined by two vena comitatus, which are accompanying the brachial artery to form the axillary vein at the lower border of the teres major, and termination at the outer part of the first rib. It continues as the subclavian vein. Cephalic vein drains into the axillary vein, and all the veins accompanying the branches of the axillary artery also drains into the axillary vein. So note, there will be a muscular arch called axillary arch, which extends from anterior axillary fold to the posterior axillary fold. It can compress on the axillary vein, resulting in the thrombosis. Now, axillary lymph nodes, most important, you already have idea about these lymph nodes, because when you have learned the lymphatic drainage of the mammary gland, you need to have a basic idea of this. So, axillary lymph nodes are around 20 to 30. They are divided into 5 groups, namely anterior group, also called pectoral, posterior group, also called subscapular group, lateral group, central group, and apical group. So, how we identify them is in relation to the lateral thoracic vein. Anterior group lies in relation to lateral thoracic vein and receives mainly drainage from breast, axillary talar spines, which is in direct contact with these nodes. Posterior group or subscapular group, which lies along subscapular vessels, and then which receives lymphatic drainage from dorsal part of the trunk as far below as the iliac crest trunk. And lateral group, the posterior medial to the axillary vein. It is located posterior medial to the axillary vein. It receives lymphatics from the upper limb, except those which accompany the cephalic vein. Central group receives lymphatics from all these three groups, anterior, posterior, and lateral. So it is located in relation to intercostal brachial nerve. So any of the central group lymph node, if it is enlarged, it will be having pain in the region supplied by the intercostal brachial nerve. Then it receives from anterior, posterior, and lateral groups. The last but not least is the apical group, which is located at the apex of the axilla, medial to the axillary vein. So upper limb lymphatics accompanying the cephalic vein will directly drain into the apical group, and upper margin of the mammary gland, and from the central group. So these are the 5 groups of the axillary lymph nodes. So we have studied about the axillary artery, axillary vein, and axillary lymph nodes. We'll see in detail about the brachial plexus in the next session. So for clinical classification, you can see in the simplest way, level 1 group of nodes below the pectoralis minor, level 2 group of nodes behind the pectoralis minor, level 3 group of nodes above the pectoralis minor, and there are rotors nodes which are located between pectoralis minor and major muscles, which makes it easier for clinicians while performing mastectomy surgeries. Thank you.